Friday's Fact Check, June is Alzheimer's and Brain Health Awareness Month, and dementia is the 6th leading cause of death in the United States, so many people are searching for ways to prevent cognitive decline. One way is through food, specifically an approach known as the Mind Diet. So to learn more, I'm here with Dr. Bijoor from Oakview Medical Associates. Thank you so much for being here.
Thank you for having me, Rachel.
And this is something that also touches me personally too, and many others. My grandmother died from dementia, and it's a very difficult disease too, but it also got me thinking about what can I do to try and, prevent that, or, push it out as far as possible too. And it's so interesting that it comes down to food. Not really a surprise, but specifically the Mind Diet. So could you explain exactly what it is first?
So what if I told you that the most powerful tool to protect our memory and to prevent cognitive decline is not in a prescription bottle, but it's actually in your grocery cart. So it is the food that we eat. And that's how the term Mind Diet came about. It's Mediterranean and dash intervention for neurodegenerative delay, so MIND. That is food strategies to reduce cognitive decline and to protect our memory long term.
Yeah.
So they did studies to find that people that adhered to this Mind Diet had a 53% less chance of having Alzheimer's dementia.
That's incredible. And there's always been a lot of talk about the Mediterranean diet, specifically whether it's for weight loss or just general wellness too. So could you kind of explain, how is this different from the Mediterranean diet, and what makes it unique for brain health specifically?
That's a great question. So Mediterranean diet is specifically for heart health and longevity and well-being. And the Mind Diet takes a combination of the Mediterranean diet, but really hones in on what is it for cognitive health. And what they found is reducing inflammatory foods and processed foods is a big component, which was really not discussed in the Mediterranean diet. But a lot of these changes are much more effective. The data has shown now that it's really reducing memory loss.
Yeah, that's incredible. So if people can remember just a few foods that we should be adding to our shopping cart this week, what are those things? And what kind of substitute should we be making too?
As you can see, it can get really complicated and confusing, but I have an easy mnemonic, which is BRAIN. So B is adding berries and beans to your diet. R is reducing processed foods. A is adding green leafy vegetables. I is including fish and olive oil, and N is nuts. So that's my easy mnemonic. Try to get beans, berries, fish, olive oil, nuts. And usually if you can get some whole grains during the day, that's a win-win.
Yeah, I think that one thing, especially, people that are focused on losing weight, they think that they need to avoid grains because it's a carb too, but I mean, it's still so crucial to have
Absolutely,
that in your diet.
We need fiber. So fiber is what actually takes the toxins out of our gut. So beans and whole grains provide fiber, which some of the other food groups do not. So.
And the nice thing about so many of those that you mentioned too is that they're great snackable foods, like berries, nuts.
Yeah.
I mean, you can integrate those. On the flip side, what are some unhealthy food items that we should probably be taking out of our shopping carts?
Yes, so definitely the things that we love. So fried foods, pastries, desserts, sweets, butter, and cheese. Cheese is processed, so try to keep those really low.
Oh, that's a rough one. That's a rough one. We don't have much more time at all, but if you give one piece of advice here just to wrap things up for folks when it comes to protecting our brains.
So I think food is medicine and lifestyle is medicine. So focusing on your nutrition, your movement and exercise, stress management, sleep hygiene, and avoiding alcohol and tobacco. You're going to be, on your way to good brain health.
There we go.
Yes.
Great advice. Thank you again, Dr. Bijoor, for your time and your expertise.
Thank you.